One of the things that has been bothersome for myself and every other Lyme patient I have talked to is on the outside, everyone says to us, "You look just fine." And inside, I don't. Other Lyme patients don't. It's a bit of a disease where you wear a mask, and it's not necessarily an intentional mask, but, well, of course it's not an intentional mask, but that's the way that it feels. If I first got sick, I'd be able to tell you every single thing compared to normal. Now it's been over 2 years, and so thinking of, well, what's normal, is I can think of what it's like and I know what it should feel like, but I can't pull out off the top of my head X, Y, and Z are all that feel wrong with me, because those things have sort of all merged together. Prior to my crash with Lyme back in 2010, physically I was very active. I played sports, did weights, ran, did just about everything. I believe I lost about 20 pounds or so within about 2 weeks' time. I didn't feel like eating at all. I got to the point of where I just required an immense amount of sleep. At school at one point I was sleeping up to 20 hours a day, and was finding myself having difficulty with completing assignments. So basically overnight, 2 years ago, I went from being able to work with near perfection in terms of good work performance mentally and physically, to the point of not really being able to do a single thing. Overnight, I began to start getting severe nerve headaches. I had other neurological issues. I started getting double vision, seeing light spasms, difficulty reading and processing. I had a constant severe nerve headache that lasted for a full 3 months. The worst was being unable to focus. The worst was I had a constant decaying feel about myself as the various bacteria were eating away at the muscle tissue. I had no concept of time. I could be staring at a wall and hours could go by and I'd have no concept of it. I would have severe headaches. This would usually be about up to an 8 or 9. I never really put anything in the 10 category, because if I got to a 10, well, I wouldn't be able to put anything higher than that if I needed to. Also, I would occasionally get various odd nerve pains. I basically had the feeling that I was getting stabbed in the side, which lasted for several months on end. Conversation, being around people, anything like that would just set me over the edge. I developed what resembled TMJ in both of my jaws, which is where the jaw locks, and it was so painful that it felt like both of my jaws were broken. It was severe, and then eventually one day it suddenly went away. What I would call a decaying feeling has since, it was very severe, and only recently has that become less so. I don't know if it's because I've just gotten used to it, or if perhaps there's been some improvement since the IV treatment. I had to go off of all gluten, sugar, dairy, yeast, vinegar, anything that could possibly feed infection or increase inflammation. I can't eat bread, I can't eat normal pizza, I can't eat ice cream. Let's see, I can't eat basically anything that's been processed unless it comes out of a bird feeder or on the side of the road. I can't eat most things. It would be easier to name the things I can eat instead of the things I can't. IV antibiotics came into the picture. I ended up getting a power line, which is basically if you can imagine an IV line that you would get in a hospital where they put it in your forearm. Instead, the way that this works is I had to go under surgery, and into the right side of my chest, there was a line that was sticking out, and the other end of it went such that it dripped at the right atrium of my heart, so it was going through a vein. It could get pulled out, the line could get infected if it got dirty. Had to do sterile procedures to change the dressing at least once a week. I had to change it more often. Then there was getting used to having fluids dripping through my system all the time. So those were a few of the oddities. You never quite understand what it's like to be on a power line until you get one. So if you ever have been in a hospital and have gotten a IV line in the forearm, just imagine it being in your chest and staying there for 9 months. One of the tough parts is, and just about every Lyme patient gets told this, is you look fine. And even if it's a very respectable, kind person, you feel like beating them over the head. Well, that or at least your mother does. So, I'll say, okay, I look great. Yeah, I can have discussions about what's going on, and I don't get headaches and confusion like I used to from just discussing things with people. So that, of course, creates a lot of problem for people that I see on an irregular basis. One of the hard things is it takes somebody who really is around you a lot to be able to tell exactly what's going on with you on a given day. Well, it just makes it difficult for other people to be able to understand. However hard they try, I wouldn't expect them to be able to fully understand. It is very isolating, but those who are willing to listen, it really makes a difference. A lot of it is just the proper terminology. Not knowing is just tough to express. It's isolating, especially because it makes it tough to do things on a regular basis as well, because you can never plan from one day to the next. And so it's a different sense of time, a different sense of when something will get done. Even if you're a sort of person like myself who likes to push through things, you can't guarantee something's going to happen from one day to another. So, in a sense, yes, that is very isolating. One of the many things Lyme has done is that it has made it impossible to ever predict the future, which never should have been able to do that in the first place, but it's made it even more difficult, because you never know exactly how long it's going to take for neurological symptoms to straighten themselves out, for physical symptoms to straighten themselves out. It's taken a very long time for me, for 2 years, and I personally see myself very far off before I would be back anywhere close to normal. I don't know if this is 1 year, 2 years, 3 years, or more. One thing it's forced me to do is to put college plans on hold and keep each season saying, well, maybe the next semester, maybe the next semester. At the same time showing me that, well, these are my desires. I'm going to have to hope for them, push for them, but also be willing to take whatever comes. My goal is to not have any limitations in the future, the far future. The near future is to live with them as best as I can, to make sure that I don't overdo things, make sure that I live within the parameters that I've been given.